All
Thank
right,
you for
welcome everyone. Oh, that's okay. Go ahead.
I was just going to say thank you for having us.
Absolutely. Yeah. Good morning and thank you for joining us today. And welcome everyone. This is Senior Tech Coffee. And today we have some special guests, Courtney Wentworth and Taylor Hulett from the company Serenity Engage. And I'm just going to run through a couple of slides really quick. Um, to get started. So first off, my name is Patrick Baker. I'm your host of Senior Tech Coffee. My business is Prime of Life Tech, and I have 30 years of IT experience. I provide IT education and tech support for older adults, small businesses, and senior care providers, both on-site and remote. And you can find out more information at primeoflifetech.com. So today I want to go through some introductions here, learn more about our guests, and then we're going to focus on their product, which is called Serenity Engage. Now, let me just for a shorthand, do we refer to your product as the Serenity app, Serenity Engage? How do you want to refer to your product as we go through this conversation?
Go ahead, Courtney.
I think it's most appropriate to refer to it as Serenity Engage. It's a full encompassing conversation platform. Right now focused on the app capability, but we have growing plans, roadmap plans that make it a full platform. But Serenity Engage, so that's the best way to find it in the App Store as well.
Gotcha. Very good. All right. So at any rate, we'll go into a little bit about what the product is and what it does, and then really what problems is your product solving in the senior care world, and then we'll try to save some time for questions at the end. So anyhow, again, if you're just joining us, welcome and thank you for joining us on Senior Tech Coffee. So first off, I'd like to just have our guests tell us a little bit about themselves. So Courtney, why don't you start? Give us a little bit, just like the 60-second background on, how you got into, how you came to work for Serenity Engage, what your background is, and all that kind of stuff, please.
Sure. Thank you. So I'm Courtney Wentworth. I am the Director of Engagement for Serenity Engage. I was able to meet Kathy Wells through Dignity Hospice, and we actually worked directly on implementing Serenity Engage through our hospice organization. I'm very excited to be part of a team. I've been in business development and account management for quite some time, and I love working with good people, good business, and it's a really exciting time to be part of Kathy's team, helping senior care teams connect with families. I had the chance to meet Kathy even before COVID, and we saw the benefits immediately, but now that COVID has rocked our world, especially in senior care, memory care, hospice, and skilled nursing. It's really important and very critical to have such a good team with Serenity Engage. So very excited here in Colorado, up in Boulder, and our office is in Denver, but we're reaching around the globe. So thank you very much.
Thank you very much for that introduction. And Taylor, please take it away.
Hi, everyone. My name is Taylor. I'm super excited to be part of Senior Tech Coffee. Patrick and I connected a bit ago, and so it was really nice to connect with him and the work that he's doing. So super excited to be here. I am the Director of Customer Success at Serenity Engage. So when you start to implement Serenity Engage into the hospice organization or an assisted living or what have you, we work really closely with me to get the pilot off the ground and get the application implemented, which is super, super fun. I got connected with Kathy Wells, our founder, also pre-COVID through a previous position of mine at Applewood Our House Memory Care Homes. And we started implementing Serenity Engage in those memory care homes, and then got connected with Kathy, and as they say, the rest is history. So super excited to be here. I wholeheartedly believe in Serenity Engage and what we do with connecting families with the loved ones' care and the care teams, and bridging ecosystems in senior care.
Awesome. Thank you very much for introducing yourself, and both of you, welcome as well. I want to say welcome again to our guests, and I think we're going to learn a lot today. And you can trade off here. I'm curious, how long have both of you worked in senior care, just generally speaking?
Great question. I have worked in and out of healthcare and the tech industry throughout my career. Senior care, I would say I'm about 3 years in, focused primarily on hospice.
Gotcha. How about yourself, Taylor?
Yeah, I've been in senior care for about 2.5 years in a very formal capacity as a career, but I've been part of senior care. My mom actually is part of Applewood and working directly with the owner there, and they've been in business for about 10 years, and so I've been part of that world since inception of Applewood Our House, but then as a more formal capacity, about 2.5 years in senior care.
Gotcha. Excellent. I didn't realize the family connection with Applewood Our House that you had. That's great. Excuse me. So how did you get involved with Serenity Engage?
I got involved with Serenity Engage through Kathy Wells. We got connected, and we've gone back and forth so many times with Kathy and I around how did we meet, and we just cannot remember for the life of us how we met. But we met, and then we started implementing Serenity Engage in one of the Applewood homes, and that's where I saw the benefits. I saw the benefits of connecting a family member with the care of their loved one. So you're bridging those ecosystems. I think in senior care, we don't always say this, but a lot of people are saying, you can be the daughter again, you can be the son again, you can be the spouse again. And that's great. Them being able to take a step back as that primary caregiver, I think is important, but also it's very important for them to still be part of the care team. We have a saying that, that eldest daughter, that eldest son, what have you, is the CEO of the care team, and they have to direct a lot of these ecosystems such as hospice and assisted living, memory care, palliative care, the list goes on. And so having a platform where they can connect all of those things to where it really bridges those ecosystems is something that I totally can get behind. And that's how I got started with Serenity Engage.
Very cool.
I have a very similar story. I had the chance to sit next to Kathy at a networking event in Northern Colorado, and I was so inspired by her story. And at the time, Dignity Hospice, we were really looking for a way to utilize our staff's time and connection with families in a much more streamlined fashion. But meeting Kathy and hearing her passion behind Serenity Engage, she had been in the tech and software industry for 25 years, and actually had her mother moved into a memory care home, and then later her father into senior living and also hospice. And through that, she really started to see the gaps in technology and innovation in senior care across the globe. And across the spectrum. And she was really burdened with having to bridge this communication between all that were included in her parents' care. And it really impacted her to see that other industries are so efficient and effective with the technology, and senior care, senior living just is not quite there. And that's because I believe they've been so focused on care. And that is a passion-driven industry. But let's step back and really start to try and help them bridge that gap. And that's where Serenity Engage comes from. And to better cultivate a community around our older adults. And so it was funny with my team, they said, Courtney, we just can't take another piece of technology. We can't do it. And I said, this is optional. This is supposed to be fun. This is going to be really helpful for you. And sure enough, within the first few months, we had quite a bit of adoption. And by 6 months, I would say we had 50% or maybe even more of our families and staff on board with Serenity Engage. And they would come back and say, I love this. I had no idea how helpful it would be and how we can minimize that frustration with families and really bring everybody together. So it was cool to watch. So I feel lucky to be part of the early adopters and watch it grow from there.
That's great. And you actually addressed my very next question, which what was the origin story of Serenity Engage? And it came from Kathy's experiences with her parents in senior care. So I think that's it's a pretty powerful story, as well as you being with Dignity Hospice being an early adopter of the technology. So I guess my next question is, and I want to, before we get too much further along, I want to give you the opportunity to maybe give us a quick demo as well, because we had talked about that. And so the screen share is ready to go whenever you are, but
Great.
I'm going to go ahead and ask my next question, and you can fire that up when you're ready. So the first question is, what do you need to use your product?
Smart device.
So just a smartphone or a tablet?
Yep, a smartphone and a tablet. As Courtney said, we do have a roadmap available, or not available. The desktop version and cloud-based version, web-based version are coming soon. But right now we're on all smartphones, so Apple, Android, and tablets.
Gotcha. Very good. And is it easy to set up and configure?
Yeah, so you work really closely with me on that. And so, I do some back-end work to get the platform built for you, get everyone's account kind of enabled and everything like that. And then we really work together on releasing those accounts to your staff, to your families, to whoever needs an account on the platform. And through our pilot process, we've really honed in like just a super simple way to get everyone on board. And then once they're on board, as Courtney said, they can go, wow, I don't know how I did this before. You know what I mean?
Mm-hmm. Now, so your users, as I understand it, are the family members of an older person who's in senior care, and then their various care providers. And that could you maybe just go into a little bit more about who your customers are? In other words, is this available only to senior care communities? Is it available to individuals? Maybe speak to those things as well.
Right. So we really focus on the care team and building a channel around that patient, resident, or loved one so that the care team and the family members are all on one communication channel. It is HIPAA compliant, so it's very safe, very secure. As you see, I'm gonna pull it up, but we want to keep it as simple and straightforward as possible, because as you can imagine, our demographic is across the scope. We've got young family members. I had a beautiful older adult that had 16 family members on her channel. Wow. Everybody wanted to know what was happening on a regular basis. So, and then we've got spouses that are 75 and plus. So I've had individuals say, I am not tech savvy, and they are very intimidated, and within 30 seconds of sitting with Taylor, they are very comfortable in it. And we purposely want to do that. But ideally, it is the care team providing updates, images, and videos around that older adult and sharing that with family. And then obviously the family can then chime in, share memories, share images of grandchildren, or especially around the holidays, some traditional moments. But it's built in that capacity so that it's really the care team's opportunity to show a moment of care that they've provided. So often it goes unknown or unnoticed. And the family on the flip side is worried to ask for more information, but really if they could just see mom out of bed or with her pearls on or enjoying a glass of Chardonnay during happy hour, dad with a fresh, clean shave, and we start to really push down this fear factor that has been cultivated throughout senior care right now. It's, you know, a photo says 1,000 words. So
I want to bridge on that too. I mean, we just found a Scripps Gerontology Center report, 92% of respondents who hear a story or accolade about their loved one from senior care feel like they're getting the right information right now. And that was from the family experience in long-term care during the COVID-19 visitation restrictions from June of 2020. And that's directly from Scripps Gerontology Center. And that's something that we can really, that's what we want to get behind is really them being part of it. You know, especially during COVID, some family members haven't even seen the room that their loved one is staying in. So if they can get a video or a photo of that, they can really be part of it, which is like really, really cool. And I think if I could jump over to the flip side of that coin too, before the demo, is we also offer the staff communication as well. So we're seeing efficiencies both in hospice and in assisted livings where the staff can communicate very quickly, because we all know with COVID, things have changed on a dime. And especially when we first started in March, things changed by the hour, it felt like. And so we see our clients that have implemented Serenity on the staff communication side, we're able to implement those changes and protocols very quickly with the efficiencies of staff communication in the application.
That was a kind of a follow-on question I had as well, is how this tool is utilized among the care providers themselves, and you've touched on that, so that's great. Please go ahead.
And I also just want to chime in with memory care when mom or dad can no longer self-report and the families need reassurance. That's been hugely invaluable. We've seen that firsthand. So here is the home screen. As you can see, it's an app that you download from your Apple or Android app. Oh my goodness, App Store. Oh, and Serenity Engage, you would just click on that app. It opens up. This is your home screen. So we have general channels, which you can see on the bottom. These are general channels. Everything is customizable based on what the client might need. And our perfect partners, like I mentioned, senior living, hospice care teams, hospice organizations, memory care, skilled nursing. So for example, the announcements channel, you click on the channel and you'll open it up and you can see that this is a one-way welcome channel that all of the individuals, both family and staff, will receive updates from. It's a one-way channel. And so you can have leadership and or executive directors be posting updates right here. Like Taylor mentioned, COVID updates, that's another channel that has been hugely invaluable for our teams right now. The environment is constantly changing. So if there are test results or PPE requirements that are changing daily or even hour by hour, you can post this here and it can go out to all of your staff in one simple message. You can put training and PPE requirements up in this channel and reminders. We've had great new creative ideas where in the staff only channel, we've had leadership or management post Starbucks gift cards along with a training question, and whoever responds to that first would get that Starbucks gift card. So as you can see, it is a messaging tool. It is allowing you to send messages very clear and streamlined across the board to your entire team. You add a message by just simply typing the message and hitting the paper airplane. You can add any photos. You can now add a video. So share those Christmas carols. Anytime you need to see who's in the channel, the top right-hand corner, the 3 little dots, you can see who is in that channel. So that's really helpful.
Now, is that who is, like, for example, would that be who is currently online, or is that just the people who belong to that channel?
That's going to be the people who are belong to that channel. And
Okay.
that's really important to always keep in mind, because some of our family members might not be able to see it right away. but you're still sending that message so that they can read it and stay up to date on their own time frame. But that's going to show you exactly who's in the channel.
Cool. Plus, it probably also is helpful for being mindful of who your audience is, regarding whatever messages you might be sending in that channel. So
exactly. Yeah. And as you can see here, we have a new message. I just want to point out, you will get notification through your phone, both sound and the red dot that tells you that you've got a new notice or a new notification. So that's in real time. So Jacob has an updated message here. And so all the staff, for example, hospice, we had chaplain, social worker, nurse case manager, CNA team. Everybody would be able to see right there in real time what the status is of Jacob, the patient.
Very cool. All right. Now I was going to mention, so for those in the audience who might be familiar with apps or programs on a desktop or laptop computer, such as Slack or Microsoft Teams, Serenity Engage is a bit similar to that in the sense of having the channels and the ability to not only send text messages but other forms of media as well. Can you also attach other types of files? Like, say, for example, if I had a PDF that was like a lab report or something like that, can those kinds of things be added to a post in a channel?
In the midst of releasing attachments right now. I think this week we're releasing attachments, so where you can attach, just like you said, care plans, different reports that include spreadsheets, documents, PDFs, and things like that. And I think it is very similar to Slack. Our platform is similar, where you have kind of group communication in these channels, and you can customize who is in what channel and things like that. And I think one thing that definitely sets us apart from Slack is our HIPAA compliance, for sure, because it is secure. You are communicating about someone's health. We are HIPAA compliant, so it is secure.
Sorry, go ahead.
Sorry, Patrick. I was just going to point out another cool tool that has really been helpful lately is you can embed a link. For example, right here, we've got a CDC link. You can embed a Zoom invite in the messaging, so you can invite all of the family at one time. At this time, hop on this Zoom link, but that link will be active in the app. So that's something really important to keep in mind. And then we've also been seeing a lot of staff do quick introductory videos. If they can't go in and meet the staff in the community or be part of that conversation with that hospice care team member, you can take a quick video of that staff member and post it in these channels. And that helps the family build that trust that's so important in those first few days of care.
That was actually another question I had is there, it seems like it would be a pretty critical time, like even those first couple of weeks or so, where your app would be particularly important to the families in terms of lowering their level of anxiety about their loved ones and that sort of thing. Would you agree with that?
Absolutely. So just, and I've seen it firsthand where I mentioned earlier, there's just this panic. They can't be together during the holidays. Maybe the community has gone into complete lockdown. And there really is, it's a horrible situation where there's no understanding of what might be going on. And this is exactly what happens. We can share moments, we can share the activities, we can show a picture of someone's room, a resident's room, so that the family members are at ease, that their room is in very good condition, mom is out of bed. Simple little updates, even allowing the families to ask the question very easily, how is mom today? And to be able to reply and send updates. She's great, had a wonderful breakfast, or she's visiting the craft center today. Anything like that is invaluable. Taylor, you've got some stories too.
And I think of Stephen Covey and things like that, where you're putting little deposits of trust, in the bank accounts. And I think there's this idea of I've never personally been through putting someone in senior care, but what I've seen throughout my career has been where there's these assumptions possibly where if you don't know what's going on, your brain can automatically assume maybe even the worst. And the senior care facility, the hospice group could be providing the very best care that they have, but if the family doesn't know that, then they should know it. They should know that their loved one is being cared for and that they're getting the best care and person-centered care that they can provide. And it removes that assumption and thus removes some of that distrust over moving someone in, putting someone on hospice. That can be a huge event. Courtney, you can talk a little bit about that with her experience about when someone does go on hospice and building trust quickly.
Absolutely. Yeah. It's just so important. And to introduce the team, everything can happen so quickly. To really have an opportunity to introduce the team and to make sure everybody knows whose role is what, and to remind them, I think I've got it in here, but to remind them what the after hours protocol and expectations might be, but to put that all in one conversation thread among all family members so everyone knows and everyone's clear from the beginning, because then throughout the care, they've got this as a resource.
Very good. Very cool.
Share another story too. I think one of our clients is putting, as you can see, this message is a different color on Courtney's screen here. It's a pinned message, so that's important information. And those pinned messages also sit in the 3 little dot option up on the top right corner. So you can see any pinned messages will show up right there. So for example, if we take a hospice organization and they are, I'm a CNA and I'm going to my next patient, right, at the facility or at their home, what have you. I'm going to my next patient. I can go right to those pinned messages and see, okay, Emily, she really loves hot chocolate. So I'm going to stop by Starbucks on my way over. I'm going to grab her a hot chocolate. But I know that information because it's right at my fingertips. So a client of ours is actually putting, I think they're calling it a yellow page care plan. I can't quite remember, but it's a very quick, like favorites, things they like to do. So you can provide just that little extra thing, and you don't have to keep it all in here. You can keep it all in your square brain because that's where it's easily accessible.
Very cool. Yeah, that's really great. So I think that we've more or less covered the basics as far as how the app works and what it provides. And if anyone in the audience has any questions about Serenity Engage, feel free to, you can either unmute yourself and speak up or type the question in the chat. But I'm going to go on to the rest of my questions and just trying to be mindful of the time. So my next question then is, what problems do you think Serenity Engage solves?
Primarily it's the family well-being factor, the patient and or resident well-being factor. We see regularly that connection avoids the isolation and depression that we're seeing so frequently right now in senior care. We've got a community in New Jersey that has one individual responsible for going around to each room every day and posting updates, sharing family updates, and now the residents look forward to that. So in a world where we are today, unfortunately, we are at this point where not everyone can have a window visit, not everyone can have any sort of interaction. So we're proud to have a tool that at least provides some sort of updates. Second, I firsthand from my team heard how nice it was to have the ability to take the emotional time of carrying the responsibilities throughout the day, but to be able to send short, just like Taylor mentioned, short updates throughout the week, just engaging with the family, giving the resident or patient information from the family so that it's saving them emotional energy to hold that information to when they get to a place that they can report. So it's helping them work more effectively and efficiently to create this genuine conversation that they're working in with the family members. So, no longer playing phone tag, no longer chasing down voicemails, no longer having to respond to frustrated, stressed out family members, which they're totally acceptable at this point with what we're working with. But it's just helping to bridge that gap and to bring a calm, peaceful element to a very, very challenging environment.
And I think to add to that too, with efficiencies and things like that, I'm very tactical. So I really like looking at the different efficiencies. Some of our clients have come back to us and said, okay, we've saved time now. They've said 8 to 10 hours a week just by not having to track down the voicemails and play phone tag and things like that. And with the staff communication as well. And so those efficiencies, I think, are worth their weight.
That's great. You guys are great at anticipating my next questions. I love it. I was going to ask, if among the communities that you're working with, if the staff have commented on or given you feedback on how it's improved their processes, and it sounds like it has to a significant degree.
Just this morning, I was in one of the Applewood organizations, where I had received a message, and I saw that a staff member posted in there, "Hey everyone, I'm new. I'm still learning how to cook the meals and figure that part out." And everyone was in there in the staff communication channel saying, "Hey, you got this. Everything's all good. We're a team here. If you need any help, we got you." That camaraderie that you're starting to build, especially during COVID with having to wear masks and things like that, still keeping that culture and that camaraderie alive is another benefit that I hadn't even really seen before. And now I'm starting to see on the application. So it's really cool.
That is very, very cool. We've touched on it kind of off and on throughout the conversation this morning, but I want to drill into it a little bit more. With COVID, it seems like your app is really filling a niche there that probably didn't well, the niche always existed, but as far as communication and reassuring the families of the people that we care for. But is there anything COVID specific that you'd like to sort of really spotlight at this point as far as Serenity Engage and how that has helped with your customers and in the communities that you're serving?
It's funny, we were actually just talking about that this morning. So well done, Patrick. So again, I don't want to ever diminish the importance of this family connection. But what we're finding is actually the care teams, the staff only channels, the COVID channels that we've created are just saving an immense amount of stress and time and organizational operations expertise, in the sense that if you've got your team all on one app and they're going around, they're obviously all in the field, but they're getting these COVID updates regularly. They're making visits. They're finding out, what the status of the COVID outbreak or PPE or whatever that might be changing on an hourly basis in senior care right now. And if they can share that with the team in real time, think about how much time they're saving from their fellow teammates driving to that location and or coming unprepared, and the safety factors if they're unprepared. If that's not there, if they don't know the status of a patient or resident's COVID testing, it's just critically important right now, and they can do that on our app safely, securely, and quickly.
I think there are some benefits that we don't even see yet. I mean, the being able to save PPE with showing up prepared or something like that, being able to save that. And then also, I think when you're in the field, you're caring for patients. You're constantly doing work and problem solving creatively and things like that. Our app, we've seen, can also pull you out of that for just a few seconds and say, hey, supervisor, I did have this problem today. I'm wondering if we can solve it a little more upstream. We can, and then the supervisor can take that on them. They got the communication quickly and they can work on solutions so that problem doesn't happen again, while the person who reported the problem can go right back into caring for their patients.
That's great. So sounds like it's really enhanced communication among the staff at the various places that you're working with. And it also sounds like there's a logistical kind of dimension there that it's proving very effective as well. Quick question. So from the chat, this is from Don. Can you share costs? Do you work with smaller assisted living facilities, or can it be cost effective for a 12-bed facility? If not, at what level does it become cost effective?
Happy to share the cost breakdown. So at this point, it is structured so that it is a per user subscription. So, and that is based on the number of residents that are active on the app per month. So it's $10 per month per active resident. That's unlimited family members and unlimited staff members. So if that's clear. So yes, to answer your question, we absolutely work with smaller homes. We've actually seen them work very well in smaller communities with that staff that's so involved. We've also seen it work really well in home care, where the home care is making those visits. So it is cost effective in the fact that you're paying for whatever resident is active during that month.
So in the example that he gave for 12 residents, it would be $120 a month.
Correct.
So
that would include, just at the risk of sounding repetitive, that would include unlimited family members. So if your 12th resident had 16 family members that wanted to be part of that channel, just like Courtney was saying, it's still that same price of 120. And if you had 50 staff members, that would be the same price as well. So
yeah, wow, that's pretty cool.
And the channels, again, are customizable. So we do have some clients that really want to feature their menus. They have a lot of attention around their daily menus or daily activities. So that's unlimited channels too, where they can customize whatever channels are being represented in their organization. We are offering a 30-day free pilot. So that is always available to anyone that's interested, but that really helps you as an organization get a real live sense of how your team will work in the platform and in the application, so that we can customize it to what will be best for you. So you can always reach out to us and start that process.
Very cool. You've touched on it already a little bit, but just in the maybe take another couple of minutes as we wrap things up here. What is on the horizon for Serenity Engage?
Here, I'll pull my 30,000 foot notebook out. I keep it all in here. But I just love talking about our roadmap and everything like that. I'm a little bit of a nerd. Okay, I'm a big nerd, so I love technology and all that stuff. So looking ahead. Let's take the example of Apple at Our House. Apple at Our House has 5 different locations. And so right now we are looking to release a thing called filters at the end of December. And what that would mean is you can filter out your different locations. So if you are a caregiver and you're working at location number 1, all you'd have to do by a tap of a button, you'd see all the residents for location number 1. If you're working at location number 2, you can tap a button and see all residents for location number 2. And that would ebb and flow into staff communication as well. So if you have all of your queue maps at location 1 and you want to broadcast a message to just the queue maps at that location, that would be that feature in there as well. So we're super excited about that. That's one of our highest priorities right now. We're very excited about that. Our second thing coming down the pipe is near the end of January. This is going to be released in kind of stages and different things like that, but moderated channels to where, so Patrick, if you're Courtney's supervisor and Courtney's a little bit new and she doesn't quite understand how to communicate with families just quite yet, but she needs a little extra love, then if she sends a message in our application, you would get a ping as her direct supervisor and you can approve, disapprove, or edit that message. And we use that as a teachable moment. And we think that's really important because, Patrick, you don't want to be inundated with approvals or disapprovals. You want to teach Courtney how to fly her own plane, right? So we can use that as an educational moment to help Courtney send the correct, effective communication to families and learn from them. Like I said, that'll be released in stages. We're looking towards the end of January as kind of starting that process, more details to come on that. As Courtney said, we have video right now and photos. We're super excited about that, sharing Christmas carols. We have an assisted living here in Castle Rock that's going to do a music concert for Christmas. And they're going to film it and share it with families. And what a cool way for them to be part of it. And it's all going to be social distance. It's all going to, follow the restrictions that we have. But the family obviously can't be there. So they can be there on the video and see it and see their loved one and everything like that. So we're super, super excited about that.
We have a hospice team in, I'm so sorry.
Go ahead, Courtney, go.
We have another hospice team. This is so cute. In Georgia, they have a music therapist that has just been so restricted because of visitation shutdowns that she can now post her videos to the residents and share it. So it's pretty cool.
And the families too, like they're all part of it, which is really cool. I said, I know we're getting a little close on time. I'm just going to blaze through the rest of this. Attachments is coming this week. We're super excited about that for care plans, PDFs, documents. We talked about that. Something that's really coming down the pipe, and I don't have a date on it yet, is synchronous video. And that is just like FaceTime, this Zoom call, but it's all within the application. So it's totally HIPAA compliant as well. And so you can start to bring in, like I said, don't have a date on that yet, but with our early adopters, we're working really closely with them and all of our clients to really understand what their needs are. And we're agile, we're very versatile in that. We can put those on our roadmap. And that's something that, our development team is incredible at.
Very cool. Excellent. Well, I know that that you have to sign off here. So if you need to do that at any point, I totally understand. So not a problem. I just wanted to share really quick. First off, I want to say thank you for joining us today and telling us more about your product. Sounds like a really great product. I've been through one of Courtney's demos before. I've talked to both Taylor and Courtney individually in the past, and I learned something more today. So I'm super excited for you guys, and I think your roadmap and everything is of what you got coming is fantastic. Very, very cool. I just wanted to share with everyone. I've got another tech coffee, the last one of the year, going to be coming up in a couple of weeks. It's going to be basically how do you do some security tune-up type of things for your computers and mobile devices. This is the contact information for the folks at Serenity Engage. So you can reach them at serenityapp.com, and you can also download the app, as Courtney mentioned, from your favorite app store. As well as you can contact those folks via email, Facebook, or LinkedIn. You can follow them there. And then this is my contact information for Prime of Life Tech. If you have any questions or comments, or you need some help with your technology, I'm more than happy to help. And I can share this information with anyone who would like to receive it. And then let me just check the chat really quick. Okay, that's you guys. So yeah, yep, very good.
I added our contact information in the chat as well. You can always reach
Perfect.
us at our website, serenityengage.com. If you have any specific questions or you'd like to start that free 30-day pilot, you can email Courtney at serenityengage.com, and that's Courtney with a C.
Very good. Cool. And folks, you should be able to save the chat if you want to be able to save the chat. And again, thank you so much for joining us today, everyone. Really appreciate your time, Courtney and Taylor. I think it's an incredible product that you have. And I definitely see the utility, especially now with everything that's going on with the pandemic. So everyone who joined us today, thank you so much. I appreciate your time and taking some time out of your day. And check back in a couple weeks for the next edition of Senior Tech Coffee. Everyone have a great day and thank you so much.
Thank you, everyone.
Thank you.